Hello, and welcome to Knowledge on the Go, brought to you by the TI Collaborative's Knowledge Transfer team here at Vizient. This on-demand podcast is designed to help you gain insights that you can put to work at your organization to help you in your performance improvement journey. Here, we'll focus on a deep dive into leading practices and lessons learned from hospitals and health systems participating in Vizient TI Collaboratives. My name is Randall. I'll be your host for today's program. Today, I'm joined by Dr. Keir Mitchell and Kendra Pitts from the University of Illinois. They're going to share some of the lessons they've learned through their value analysis journey with orthopedic implants. Physician buy-in is a complex process, Keir. Can you tell us a little bit about how the University of Illinois handled that process?
We realized we had some quality and cost issues around total hip and total knee. We're excited because we had all this data that we felt we could act on and met with them to share that and try and get them to buy into that. I think there wasn't a lot of trust at that period of time, and we just thought you see the data, you'll understand it. I will say that first meeting didn't go well. So we really had to take a step back and realize you have to build that trust with that physician first. And I think it's important to be open to having to do that. I think we could have gone back and been like, forget it, or there's a roadblock, let's stop. Mm-hmm. But I think this was really important for us because it also builds relationships when the physician asks for something and you don't just walk away and they're don't hear from you. You go back and you get it and you bring it back forward again and again and again until that you get it where it's meaningful for them.
How did you make that shift, Kendra, so that the information was meaningful to physicians?
We used the line item data and the overall cost of implants. We definitely took that into our physicians, and we also had our own costing data. A story that had happened is that we used that information, we presented it to the doctor, and he didn't believe it, that what his cost per case was. He's like, there's no way I can be this high or more so or than another doctor. So he asked us to go back, and he gave us certain categories of how he wanted to see the information. So that took some time. I went back to the vendors and had them classify the data that Vizient had given us and our data into the categories that he wanted to do for him. Turns out it was almost the exact same number or the cost per case was about the same, even in the categories that he wanted it.
Sounds like an involved process, Keir. How long did that take?
It took us several months to get the physicians to the table to really start to talk about quality and cost. And we really went back and forth with them, giving them the information that they wanted. And what I learned from that was it really isn't just about the science of healthcare. It's really about that art of leadership.
The physicians at your organization really took ownership of the process, Kendra. When did you know they were bought in?
Our head physician and went out and spoke with the vendors directly, and that rarely happens with physicians. When one dropped out, he got that vendor back on board and really just fought our battle for us. So that was really advantageous. He was vested in it and willing to step up and make that change as well, too.
What about you, Keir? Why do you think the head physician took that step?
At the start of it, it's not like we came to him at the end and said, oh, it didn't work. Can you please go talk to this vendor for us? It was more that he understood where we were going and what the long-term objective was. And so when we started to struggle with it, he said, let me do this component of it. So I think that was important.
That is stepping up for the team. Who was selected for the team, Kendra?
I represented the materials management, purchasing, and value analysis for that. Keir and some other managers were a part of our inpatient and outpatient. We had our surgical services team, the director of our surgical services, and one of the service line coordinators for orthopedics was a part of that decision as well. We also had a member from our reimbursement team to give us feedback on the reimbursement, and then a senior leader from our executive team, or C-suite, was also involved in that as well. Finally, Dr. Gonzalez, our physician lead, he was a member of our team, and he is the head of our orthopedics department and was able to represent the three physicians that we had and get that information back to him as well.
What helped you build your case for change?
We had started to see a lot of vendors bringing in products that were not approved, and our cost per case started to increase again. So we're right next door to a large orthopedic hospital, and we've heard, well, they're getting the best pricing because they do 3 times as many surgeries as you do every year. There were some large IDNs that had a substantially better volume than we did that were having worse pricing than us, and there were some smaller ones that had less volume than we had that were getting better pricing. That kind of opened our eyes, and it helped to eliminate that, at least that point of contention with the vendors when they told us that. We kind of determined that that's not accurate and it's not true. There were certain hot button topics that we wanted to discuss with our physicians in order to make our case for change. We used a lot of the Vizient data, and we were able to determine that some people were getting better pricing that had lesser volume than we did. We kind of knew we were between the 50th and 75th percentile for pricing. So adding that metric in there really sealed the case for us to be able to present our case to the physician in order to move forward with this project.
Is that how you saw it, Keir?
We learned through this collaborative what the implants get back in terms of their profitability and what goes to research and development and their overhead. I think you tend to sell to us that if you're going to cut into research and we won't be as innovative. We had that knowledge now to be able to talk not only to the vendors but to our physician groups who hear that same message when they're working with the vendor in the operating room that we're giving you the best price we can based on your volumes, or if we go any lower we're going to lose research. And so I think those were two impactful things for us in terms of making that case for change.
And that helps you put things in focus, Kendra?
We used a lot of the Vizient data that they provided as far as market information. It just so happened the timing of the Orthopedic Implant Collaborative kind of was simultaneous with looking at that category again for us to see what other opportunities were out there.
What were your results?
Overall, we look for our savings to be about 21% of our current spend right now. So that's going to be a substantial yearly annual savings for that. So hopefully that'll, like I said, it will be rolling out within the next couple of months.
We had meetings up to the last minute before we left related to how do we change this and how do we look at the implant costs differently and what are we sending back to the vendors. It's a reiterative process that you continually have to go back and forth and change, and it's a never-ending cycle.
Kendra, how do participants deal with the demands for new technology? And you see that balance every day.
We definitely see all the new products requests that are coming through and balancing that out and being able to look at some current initiatives and at least identify some of those cost savings opportunities, especially being an academic medical center. They always want the new and the best and the finest technology out there. And cost savings, we kind of use it as a leverage. If you want some of this, you got to give up a little bit. If you can move towards savings on orthopedic implants, maybe we can move something and get some new products in there for you.
Thank you, Kendra and Keir, for joining us today. I really enjoyed our conversation. We'd love to hear from you about today's program or hear your ideas for future content. Reach out to us by email at knowledgetransfer@vizientinc.com. For the Vizient PI Collaboratives and Knowledge Transfer team, this is Kelly Randall. Remember, knowledge is transformational. Share it.